Hello, my name's Simon Stretton-Downes. I've been the principal dentist here at Trinity Dental Clinic in Monrovia, Liberia since July 2017. Trinity Dental Clinic was started back in 2008 as an inspiration of two North Americans, a Canadian dental therapist called Frida and an American dentist called Keith. They were both working on the Mercy ship, and they just felt that there was a real need to have a land-based clinic facility. And Frida came here in 2005, and the clinic eventually opened at the end of 2008. And that was their brainchild, to provide a land-based facility and to also to develop training for Liberians to be able to do dental kind of work themselves. They were able to send two of the staff to India to train as clinicians, and a third member of staff to make dentures. And each of them had 6 months training in India and then returned to the clinic. When I came to Liberia in July 17, the clinic was being run really well by Eddie, supported by Matilda, who'd had the training in India. And they had some assistants, and then there was a couple of people making dentures and a hygienist that Frida had trained. And they were providing basic dental care, and Eddie was also the clinic administrator as well. And they were doing a great job to keeping things running without any fully qualified dentist at all. Liberia is in West Africa. I think the main thing to know about it is it's hot and sticky, and the temperature very rarely drops below 24, 23 degrees, and even then it's still hot and sticky. In a rainy season, the temperature does drop a little bit, and the rain helps to cool things off. But as soon as it stops raining, the heat comes back and all the moisture comes back up into the air again. So it's an acquired taste living in Liberia. It's a country that is low down on the economic scale. A lot of people are in need, and certainly in terms of dental need, there is a very, very small number of practitioners. I think the statistics are somewhere around about 7 or 8 dentists and maybe around 17 practitioners doing basic dental care for a population of over 5.6 million people. And most of the dental practitioners are in the main city here in Monrovia. I tend to categorize the dental problems in Liberia into 3 main areas, and by far and away the biggest problem is tooth decay. Dental caries. I don't know what the percentages are, but a significant number of our patients come to the clinic because they're having pain in their teeth due to tooth decay. Sometimes they have swelling. Sometimes the swelling can be severe enough to require hospital admission for drainage, and some patients even die because of that swelling. It's a condition called Ludwig's angina. And untreated dental decay is a massive problem in Liberia, and certainly that's the biggest need that we see. Second down on the list, I would have to say trauma. Now, trauma, we can divide it into 2 main groups. A common problem in Liberia is that Liberians like to chew bone. And when I say chew bone, I don't just mean nibble a little bit of chicken bone. They like to get cow bone and crunch the bone into powder with their teeth. Needless to say, teeth aren't designed for this, and we see a significant number of patients who fractured their teeth as a result of chewing on bone. And most of the time, those fractured teeth have to be extracted. I did offer to stand as president on an anti-bone chewing platform back in 2018, but my staff told me nobody would vote for me. It's a very common problem. The other kind of trauma is trauma that we see anywhere. So people falling over, especially young children, sports injuries, fights, but particularly we see quite a few cases of broken jaw. Most people are riding motorbikes here with no helmets, and motorbike accidents are very common. And so we see quite a few cases of broken jaws as a result of motorbike accidents. So that's the second category. And the third category I would call lumps and bumps, cysts, tumours. We see quite a few benign tumours. There's a condition called ameloblastoma, which arises from the cells that make the enamel of the teeth. And this can cause really large tumours, slow-growing tumours of the jaws. Fortunately, we have an avenue to get these patients treated in Guinea, but these are very unsightly. We also get some fibroosseous lesions, we get cysts. Sometimes the cyst can be like this, sometimes it can fill the whole ramus of the mandible. So we see conditions that people just wouldn't present with back in the UK. We also see quite a lot of osteomyelitis. This is dead bone in the jaw caused by tooth infection that's been untreated. And sometimes the osteomyelitis can be so extensive that it starts in one tooth and spreads right round the jaw. It affects the whole of the jaw, the ramus and the body of the mandible, and they can be very, very difficult to treat. Some of them need half of the jaw removing as a result of osteomyelitis. And I think those are the main broad categories of patients that we see. The other day we had a young boy. He had osteomyelitis of the maxilla, which is quite uncommon. What it looked like to me was he'd had a decayed upper first molar, and he'd been to see a traditional healer. And the traditional healer had put some medicine on the area. My suspicion is that that medicine included battery acid, because there was a large area of dead bone, which when we ended up treating it and exploring it, it extended all the way from the first molar right to the front tooth. And the whole piece of bone came out in one piece with 5 of the teeth attached to the bone. Very, very extensive. All due down, starting with a tooth infection. And untreated tooth infection is a massive issue here in Liberia. We're very fortunate to be able to liaise with a colleague from the UK, Dr Tony Giles. Tony worked for many years on the Mercy ship, and in more recent years has spent time in various countries in Africa training local surgeons, and he visits Guinea and in the process visits us once a year usually, and he's been a great help providing advice in person, but then more importantly I suspect via a WhatsApp group that all our clinical staff have access to. So when we get a difficult case, we post it on the Trinity Dental Therapy pathology group, and for some reason Tony seems to have nothing else to do but sit by his phone, and sometimes we even have live conversations about a patient, and he's able to give us advice on how to treat it, what tests we might want to do, and he's very, very polite. He never says, "Simon, you were really stupid treating that case." He usually would say something like, "Well, maybe I would have done it like this." And one of his other favourite sayings is, if we're not quite sure, he has an imaginary box with a key round his neck, and we open the box, and inside the box is a piece of paper. And when you read the piece of paper, it says, "Watch and wait," which is one of his axioms. The other thing that Tony likes is hot, salty water. He calls that one of God's special medicines for all its healing properties, and we recommend it liberally. I've been in Liberia now for over 6 years, and I've trained staff in the clinic to take teeth out, which they do very successfully. But the staff have no formal qualification or recognition of their skills. And over the last few years, we've developed the idea of the Liberia Dental Therapy School. There is no formal dental training in Liberia for anybody. And we've sent 3 of our staff out of Liberia to train as dentists, but actually there is a greater need for people to be trained at a lower level to be able to provide more basic care, particularly tooth extraction. And so in 2022, we successfully opened the Liberia Dental Therapy School, and we've been developing lecture material following a curriculum that was created by Dr Rob Whitton from Peninsula Dental School in Plymouth in the UK, and he came out in December 21. And we met with staff from Cuttington University, which is the largest private university here in Liberia. And we've worked together with them to develop a curriculum that includes basic elements of English and maths and computing, ethics and business studies, which are provided by staff from Cuttington. But we then provide dental lecture material following Rob's curriculum. And so far, we have trained and been through the first year of the curriculum. And between now and May next year, we will be doing year 2, with the aim that our 7 students will graduate with an associate degree as dental therapy practitioners in June 2024. Very excitingly, with the arrival of Dr Renju from India, we plan to be taking on another 8 students in November, and Dr Renju will be leading that cohort of students, and they would then be due to graduate in June 2025. So in this first cohort of dental therapy students, what we've wanted to aim for is to provide validation for Matilda, Archie, Daniel and Charles, who've got skills but nothing formal. So those 4 students have got scholarship from Cuttington, which means we don't have to pay for their Cuttington fee. They've continued to work in the clinic throughout their training, and once they qualify, they will continue to work in the clinic. The other 3 students have come to us through the ECOL, that's the Evangelical Churches of Liberia church, recommended by the church to be trained. They all had a nursing background, and when they qualify, they will be going back to the parts of Liberia that they come from to work alongside the church to provide dental services as an adjunct to the ministry of the church. And it's particularly exciting because they'll be going to areas where there is great dental need. The church is also serving the community with the gospel, and what we will then see is a combination of a dental ministry with a Christian ministry, meeting the whole needs of the people of Liberia. As part of the training course, we did a module on public health recently, and the original plan was that they should give a presentation about tooth decay or oral cancer or some dental subject, but given the material that we were covering in the public health course, we decided to set them the challenge of coming up with an oral health strategy for Liberia, because the WHO is recommending that all member countries, which includes Liberia, have a dental oral health strategy. And Liberia doesn't have one at the moment. They've recently appointed a nurse to be the oral health coordinator for the Ministry of Health. And so we invited her to come to listen to the presentation that our students made. I worked with them, and they presented the topic oral health strategy for Liberia, which included acquiring data, looking at oral health promotion and disease prevention, how we could establish a workforce, and then fourthly, how we could sustain that workforce over the coming years. So it was very exciting to have all these people coming together, and we've subsequently been invited to a government meeting to help the government look at how to develop an oral health strategy for Liberia. When I was discussing with the students how to develop the oral health strategy, I said to them, okay, let us imagine that you guys are the committee for the government. What do you think you would like to see over the next 10 years? And in addition to getting some qualified dentists, what they said they would like to see was 70 dental therapy practitioners spread around the 14 counties of Liberia. There are 15 counties in Liberia, but Monrovia County already has a number of dentists and dental practitioners. So they said 5 practitioners in each of the 14 counties, so 70 practitioners altogether spread around Liberia, in places where currently there is absolutely no people meeting oral health needs. We get patients coming from across Liberia to get dental care at the Trinity Dental Clinic, and having practitioners located around the country to meet oral health needs, properly trained, properly accredited with the Liberia Medical Dental Council, to my mind, has got to be the way forward, and that's what we're trying to do through the ministry of the Liberia Dental Therapy School as part of the Trinity Dental Clinic. Once our students have qualified, the exciting thing is not only will they have an academic qualification through Cuttington University, they will have an associate degree, but at the same time they will also be registered with the Liberia Medical and Dental Council. So they will have an academic qualification and a professional accreditation. And I think once we end up with more graduates, we will also create a Liberian Dental Therapy Association combined with a WhatsApp group so that they can get clinical support where they need it, and try to maintain the skills as they go out and be used. They're not going to be wasted because they can't get their supplies, they can't get the support that they need. So we're planning on creating a support mechanism through which the students can get their supplies to work alongside the hard equipment supplied by Dentaid. When we designed the current dental therapy school, which was opened in March 2019, we thought having 8 clinics, which was double the number that the old clinic had, would be more than enough. But because of all the people that have been trained, and now we've got additional dentists as well, we don't have enough space. There are days when I don't even have a clinic to work in anymore. So originally we designed a bespoke building made out of concrete block to be both clinical space and classroom space. This was going to cost quite a lot of money, and to cut a long story short, we've revised the plans to something that is both affordable but also practical. So we're currently developing what we're calling the container clinic, and this is using 2 40-foot shipping containers, which are going to be located parallel to one another with a 20-foot gap between them, and then corrugated roof over the top. And this will be turned into 4 additional clinical areas, classroom and some office space. And then the space in the middle at the back, we will turn into a sterilisation area. And the aim of this, apart from providing additional clinical space, the aim is to provide an environment that will be similar to the kind of environment that the students will be working in when they've qualified, those who are working in the rural area. So these clinical spaces will have a portable dental chair provided by Dentaid and hand instruments for them to work with, so that it will be very basic, and they will learn to sterilise their instruments using a pressure cooker and storing them in plastic containers, using local anaesthetic from a bottle drawn up in plastic syringes with a needle, so that it will mimic the conditions that they will then find when they're going out into the big wide world. And they won't be expecting, oh, I can't do this because I don't have a cartridge syringe, or I don't have a handpiece, or I don't have suction. They will be learning on the job to use the more basic facilities. The Trinity Dental Clinic has 2 ways of managing its expenses. So the clinic itself is structured at the moment, and has been for the last few years, so that the income from patient treatments covers the cost of the day-to-day running of the clinic, the materials that we use, the utility bills, and the salaries for the staff. So those are covered from patient fees. The rest of it, the running of the dental therapy school, the container clinics, larger expensive items of equipment, are funded from the project. Now, the Trinity Dental Clinic project relies entirely on donations, mainly from outside of the country, in order to fund the running of the school, the building of the container clinic, for example, equipping the container clinic. And so we look to outside donors to support that work. In theory, it will be lovely to anticipate funding coming from the Liberian government, but at the moment that is not a practical option. Some of our students in the future, we're looking at them to bring sponsorship with them. That means individuals that they personally know, or organizations that are going to employ them, that are willing to fund their school fees in order to then have them work for them on their institutions when they qualify. So there's a mixture of funding streams that we rely on. Currently we have working in the clinic myself, Dr. Renju and his wife Dr. Serin, and Dr. Melvina from Switzerland. All of us four come as missionaries to work in Trinity Dental Clinic. That means that the funding to cover our expenses comes from outside of Liberia. We do not derive any income from the work that we do. So we generate income for the clinic, but we do not take any income from the clinic. We have one Liberian dentist, Dr. Hina, who came to us a couple of years ago, having trained in the Philippines, and we pay her a salary to work in the clinic, and her salary is covered, as I mentioned before, by fees generated from treating patients. There are a number of ways people can support an individual student. They can help cover the cost of field kit, and they can contribute to the general running expenses of the school. And that can be done through the Trinity Dental Clinic project via the SIM website. And you can find details of that at the end of this video. There are a number of prayer requests that would really be beneficial to pray when we're thinking about the Trinity Dental Clinic. Pray for our 3 students that are currently training to be dentists outside of Liberia. That's Eddie, Wani and Helena. Pray for the dental therapy school students, those that are currently in training, those that we hope to take on later this year. And pray for the love of Jesus to be demonstrated through the treatment of patients through the dental therapy school. We're really fortunate in Liberia. It's perfectly acceptable to pray for our patients before we treat them. We have a member of staff sharing the gospel in the waiting room first thing in the morning, and we aim to show the love of God through the treatment we provide. So pray that that would happen and that God will be glorified as we treat our patients. Many come to us in great need, and we hope that they go away having seen their needs met in the name of Jesus Christ.